This is depth of focus for V551. What's the definition of depth of focus? Depth of focus is the variation in image distance in an optical system which can be tolerated without incurring a decrease in resolution. That's a pretty big mouthful. Let's think about it in simpler terms. In simpler terms, the amount of blur that can be induced without changing visual acuity. Here's two examples of kind of depth of focus, depth of field, looking at these two flowers. In one image on the left, both the flower in the front and the flower behind are crisp and clear. On the right, the flower in the background is actually blurry, as is all the grass and everything else. The one on the left has a greater depth of focus or depth of field than the one on the right, because everything is clear, both at distance and up close within that image. The one on the right has a smaller depth of focus, because in the periphery, as we move far away, things become blurry. Now, there's a difference between depth of focus and depth of field. Depth of focus is the amount of blur that can be induced via change in lens power, whereas depth of field is the amount of blur by a change in distance. So this flower example is more of a depth of field rather than depth of focus. Depth of field is used more often in photography when we're thinking about the picture, as is the example down here. Depth of focus is what we typically use more in the clinic because it's in terms of the patient's perception and our ability to prescribe lenses. However, for 95% of clinical applications, the terms are equivalent. Here's a through focus example of the depth of focus. We go from plus 75 to minus 75 in quarter diopter steps looking at the 20/20 line. At plus 75, the letters can't be resolved more than half of the letters. As we switch and get a click of minus, we go to plus a half diopter. A person can see actually some of the letters, they can get most of them correct there, maybe 3 to 4 letters easily correct, saying D, and it's struggling with the H, E, V, P. We add another click, it's still clear. We add another click, it's still clear. We can still make out the letters. Now that the focus might be changing as far as how the quality of the blur goes, but they can all be resolved, and that's the point of depth of focus. The resolution is still maintained, even if the subjective clarity isn't quite equivalent. And as we click through, we see that the focus then starts to go back down as we add more minus. Now the range from plus 50 to minus 50, or plus to minus a half, is our depth of focus. In this image, plus or minus 50 was clear. They could resolve that letters. So the depth of focus is plus or minus a half. And that's a normal range for most people. As you get older, the depth of focus goes up. As you're younger, the depth of focus goes down. So what are some factors that influence the depth of focus? Pupil size. The smaller the pupil, the larger the depth of focus. Luminance, wavelength, and contrast of the target being used can affect the actual depth of focus. With lower luminance, lower contrast, making it a smaller depth of focus. Also, optical aberrations of the patients can affect it. Cataracts in particular increase the depth of focus at the expense of contrast. And all this assumes there's no change in accommodation. So an accommodative change that increases the vision is not a measure of depth of focus. That's accommodation by itself. That's a separate category. Well, let's look at pupil size and how it affects depth of focus and how it actually affects vision in general. We have an optical blur patient here for minus 2 diopters of myopia. When we look at 2, 3, 4, 5, and 6 millimeter pupils, what happens to the image quality as the pupil size decreases? The image quality actually improves as the pupil size goes down. And that's why how depth of focus is working, is it's improving the overall image quality, and that's why pupil size matters for depth of focus. An extreme example of that is the pinhole that we've already shown earlier. In this example, we have an emmetrope, a myope, and a myope with a pinhole. In an emmetrope, the image is focused perfectly on the retina, so there's a small blur size on the retina, so we can resolve that E. In myopes, because the image is in front of the retina, we create a large retinal blur size, and that makes it impossible for us to resolve the letters. When we add the pinhole in, which is also effectively changing the pupil size, we're decreasing the pupil size to 1 millimeter. We decrease the retinal blur size, and that makes the letters resolvable. And that's why depth of focus matters for pupil size, is that as the pupils get smaller, the depth of field or depth of focus increases. So why does depth of focus matter in the clinic? It helps us guide clinical decision-making when to prescribe certain types of prescriptions for people. It also influences our testing procedures. Here's two patients. They both come in with -2 diopters of habitual glasses. Their chief complaint, one has a chief complaint of distance blur, the other one is in for a routine checkup. After completing the refraction, we get a -250 in both people seeing 20/20. The only thing different between these two eyes is their chief complaint. In the end, we prescribe for patient number one the extra half diopter minus for a 250, and we don't prescribe anything for patient number two. You might ask the question, why is that? We'll both see 20/20 with the new prescription change, but we give that different prescription because of the chief complaint. One person has blur, one person doesn't, and because the depth of focus for the average person is about a half diopter, we know there's an error signal now in here of about a half diopter. If this half diopter change in patient number one will improve their vision and improves their symptoms, then we're going to prescribe it. Conversely, patient number two, who had no complaints and saw pretty well, we might think that error, that -250 from the refraction, is actually due to depth of field or depth of focus issues rather than a real prescription change. Another situation is how we do testing. Traditionally in refraction, we do things in a quarter diopter step. But that's not always the case for all patients. At the top, we have two patients with different depths of focus. The top person has a larger depth of focus. The bottom one, the middle one, has a smaller depth of focus. The smaller one being a younger person and the larger one being an older person who has smaller pupils. Because these have different depth of focus, we then use different steps when we're going through a refraction. So let's say we go through and we say, in quarter diopter steps, better one, better two. For a person with a large depth of focus, that's the top group here, it's impossible for them to differentiate because the letters look equally well. They might not be equally clear, they might not be clear, they still might be blurry, but the patient can't detect the difference between them in a quarter diopter step because they have a large depth of focus. So what does that mean we need to do? We need to increase the size of the steps to actually have the patient be able to differentiate the change in refractive error. So in the second group, we've added a half diopter steps. In that case, the patient can differentiate between a half diopter step, which one is clear, better one or better two, and they would say better one is definitely clear, number one is definitely clearer than number two. Now, what if we have somebody with a very small depth of focus? In that case, it doesn't really matter if you use a quarter or a half diopter steps. They can differentiate that number one is always better than number two, and so they don't need that larger depth of that larger step. They can use the smaller step of a traditional quarter diopter. Thank you. The end.